The Salud Mesoamerica Health Initiative project aims to improve the access to quality health care for the most vulnerable 20% of mothers and babies across 8 countries, including Belize. The second operation of the project, valued at $600,000, was funded by the government and the Inter-American Development Bank with funds from donor partners. This project was executed in the north and west of Belize, and today Dr. Cassandra Rogers of the IDB shares some of the achievements of Phase 2 of the project.
For example, early postpartum care has increased by 81%. Likewise, the use of oxytocin, a hormone that speeds up delivery and reduces the risk of heavy bleeding during childbirth, increased from 34% to 98.7%, and the number of infants receiving quality care after delivery went from 19.4% in 2013 to 88.7% in 2017. Really significant results.
The end of this operation means the start of the third phase, which seeks to further improve the access, use, and quality of maternal, neonatal, and child health services. According to CEO Ramon Figueroa, it will target over 50 communities in Corozal, Orange Walk, and Cayo districts. He explains how it will work.
But what we're looking in this third phase is really going into more preventive type interventions, educating younger women. We call that the preconceptional phase, looking at building up on their knowledge in terms of what are the risk factors in pregnancy. And child rearing and etc. So those are basically the things that we will be focusing on in this third phase. To do that, we are actually developing a different strategy for community involvement. It's what we call the community platform. And that entails going into the different communities. We're targeting about 50 different villages, 52 different villages in the project area, where we go in to discuss with the community what their prevalent needs are. It's more of a partnership with the community as opposed to the traditional way we approach, where we either place most of the burden on the community health worker, or we go into the community and tell them what are our needs and our priorities. This is more of a partnership so that they understand where we're coming from, help us identify what are some of the risk factors or risk groups within the community. And together then we develop interventions at the community level. So it's going to be a lot more intensive, but I think over the long term, a sustainable strategy for better community participation in health and wellness.
Belize is only one of 2 of the 8 Mesoamerican countries that met all the indicators, and so was rewarded $150,000 in grant to invest in other local health initiatives. Reporting for News 5, I'm Andrea Polanco.